One of the most common conversations that I have with patients in my office is about the timing of joint replacement surgery. So there are a lot of upper middle age and older adults that are living with and dealing with chronic arthritis of their hip or their knee. And a lot of them sort of know they may need to have surgery at some point. And so for a lot of patients, the pain is what drives it, and it just becomes inevitable when the pain is too much to deal with. But the other part of this that's under considered is mobility and how a bad or arthritic joint affects someone's ability to get around, but also to maintain their health. And what I mean by that is that we have to keep moving in order to stay healthy. For all of us, as we age, our risks in life shift, and things that are potentially limiting and even potentially fatal to older adults have to do with frailty and immobility. So as we age, the way that you maintain your muscle mass, maintain your bone mass, keep your body weight down, keep your heart pumping, and stay healthy is to move. And at some point, arthritic joints can get in the way of that. And I think we all sort of misconsider risk and how things affect us, and we tend to overconsider the risk and the downsides of doing something, and we tend to underconsider the risk associated with doing nothing. And so for a lot of patients, because they're thinking about, well, when am I going to do this? When am I going to have time to rehabilitate from surgery? Is it going to hurt? What if something goes wrong? All these very reasonable considerations get overplayed in their head because they're not considering, well, what's the downside of me not doing anything? And often the downside associated with that is increased body fat gain, loss of muscle mass, loss of bone mass, decreased exercise, decreased activity, decreased aerobic capacity, and eventually health problems that happen because of that immobility. So it's very important to take all of that into account and sort of figure out where you're at in the course of your arthritis and of your joint issues.